Conference here on Delaware's response to the COVID-19 pandemic. We've been doing these on a regular basis, weekly, trying to get good information out to the public. We thank our media partners who are here for covering the press conference and for getting information out to all Delawareans across our state. I'm here today with a different lineup. Normally we'd have Dr. Rattay, the Director of Public Health, and A.J. Shaw, the Director of the Delaware Emergency Management Agency. But today, because of, in some ways, a change in the conversation from what are we doing in response to the pandemic, and that's still our major focus, but also a discussion across our state about what do we need to think about to reopen the economy gradually in Delaware. And so we've got Secretary of Labor, Saran Cade, who's here to talk about unemployment benefits and other benefits that have been made available by this State Department of Labor in conjunction with the stimulus package coming out of Washington, D.C. And again, we thank our congressional delegation and the bipartisan work in Washington over the several stimulus packages that have passed the Congress and that are making funds available to individuals and small businesses here in our state. I'm also here with Director of the Office of Management and Budget, Mike Jackson, who's been watching the situation and helping us on so many levels with agencies and staff, allowing people to work remotely and working with cabinet secretaries on making sure that they have the support they need on the HR side, on the budget side, and also importantly, keeping his eye on our revenue projections. Yesterday we had the meeting of the Delaware Economic and Financial Advisory Council, which is empaneled to do the revenue estimates on an annual basis on which the state's budgets are based. Their recommended or their estimate from January or from December was the basis of our budget in January, and a lot has changed obviously over the last 2 months, and so there'll be a lot of discussion about that as I travel around, and the phone calls that I get increasingly are about that, the effect of the real shot in the economy to state revenues and state operations, and what are we going to do about it? What's the budget situation going to look like? I expect we'll get some questions about that. Certainly Mike has some information to share about the revenue estimates from yesterday and the significant hit that the state will take with respect to declining revenues. Fortunately, we entered this unprecedented situation in good financial position, which will enable us to react as well as possible to that. And of course, the conversation that increasingly we'll be engaged in will be with members of the public, with workers, with businesses, large and small, in terms of how we can reopen the economy here in our state. In our last press conference, I talked about the document, the guidance that was provided by the White House Task Force with recommendations for from the CDC about the conditions that need to be present on the ground in each state for states to start turning the lights back on in their economy and eliminating some of the restrictions for businesses that are currently closed, for certain gatherings, and those decisions, I suspect, as I've been saying for the last week or so, will probably be more difficult than the very difficult decisions we had to close down our economy, because we certainly want to keep foremost in our mind the health and safety of every Delawarean and not jeopardize anybody's health by opening too quickly and by putting people to risk. What we do know is that the world, as we reopen our economy, is going to be very different operationally for every business and agency. All Delawareans are going to continue to have to look after appropriate hygiene, washing their hands, coughing into their sleeve, not rubbing their eyes or faces, and keeping appropriate social distances when they're in public. We've already recommended that folks wear masks when they go in public in areas where it's difficult to observe appropriate social distancing. I suspect we'll see more of that. At least 2, maybe 3 of the states surrounding us have moved to a mandatory mask wearing for individuals out in the public, and it's something that we will look at as well. So we've got some very difficult decisions ahead of us. The bottom line, as I say all the time, is we have to have a healthier community before we can make our economy healthy again. And it's not a choice one over the other. We have to have both. But a healthy community at some level has to be present first before we can have a recovering and healthy an economy. And we'll try to really strike the balance between the two. We've been given a guidance by the CDC about the conditions on the ground that have to be here in order for us to open the economy in phases. They're recommending 3 different phases, and we'll come up with our own Delaware-specific plan that will use the guidance from the CDC for reopening here in Delaware. The first thing we need to do is sort out the data that we'll use to make that decision. And I think most importantly, what's the testing program and plan going to look like that will enable us to move from a period in time where we've closed a large portion of Delaware's economy and asked people to stay at home and to stay shelter in place to a world where we're moving back to work in a cautious kind of way and cognizant of the need for social distancing and the fact that the virus will still be present in our community. It'll be difficult to arrive at a set of numbers because the testing plan and program that we have followed over the last 6 weeks has not been consistent day to day, and more importantly, the results don't come back on a predictable basis. We've had turnaround times as long as 10 days, 2 weeks, and as short as 3 days, not including the tests that we're able to turn around in 24 hours here at the State Public Health Lab. So we'll be working on that. We'll be bringing to you our plans and engaging the public on that with public outreach and engagement. But let's start with a look at where we are with the number of positive cases. They continue to trend upward, and sadly, we've experienced 10 more deaths over the last day since the last report. We're up to 82 now with 565 recoveries and 263 hospitalizations. As I've said time and again, that hospitalization number is the one we really look at and try to look beneath that number as to how many of those patients require ICU beds and critical care and ventilators. And we feel pretty good about our capacity there. That number at 263 has leveled off a little bit here upstate, but a few more hospitalizations in the lower part of the state. So here's the breakout by county, 1,303 in Newcastle County. In Kent County, it's 459. Situation remains pretty good in Kent County. Then finally in Sussex County, we've had a little bit of an uptick in cases down there, up to 1,139. And importantly, in the period from April 14th to April 20th, we had an increase of about 41 patients in the hospitals and an increase in the number of cases, positive cases, of 500 during that period of time. So there's some concern there for a spread in Sussex County, and we'll talk a little bit about our approach to that. We have 30 cases that are unknown in terms of their address. Here's the breakout, or the age breakout. Increasingly or consistently, the vast majority of the cases are adults 18 to 64 years old, and the most vulnerable population remains Delawareans 65 and older. So I mentioned our response to some of these numbers, doing more outreach in minority communities, particularly in Sussex County, and we'll increase testing locations down there in cooperation with Christiana Care, who's going to make available their testing, a mobile testing unit, bring down there to various places in the community. We have a team of folks working with the Department of Health and Social Services, Division of Social Services, and outreaching to these communities to get information out about getting tested, try to test more folks down there and isolate those who test positive. We'll have new reporting time from the Division of Public Health. This has varied a little bit over the last couple of weeks. The data updates will be released in the noon hour each day. So it has tend to vacillate a little bit, but we'll try to get those data out in the noon hour. Again, I don't think there's a need to go over the timeline of our amendments to the state of emergency declaration, which we first made on March the 12th after the first confirmed positive case of COVID-19 on March the 11th. We closed restaurants and bars on the 16th and beaches and all the other actions from there, stay at home, out-of-state quarantine, additional restrictions on nursing homes and certain businesses, a banning of short-term rentals and short-term and commercial rentals, and then stricter measures in the long-term care facilities. So the next series of slides will again take you through the projections and predictions that we looked at over time. This is the basic bar chart of the total number of cases with the hospitalizations, the small little bar at the top. You can see the two top lines. The red line there is our model projection from April the 11th. And as you can see, it's trending above the actual experience. And then the blue line is the projection from the model on April the 14th. And you can see as it extends over to April the 23rd, our cases have been below those projections. And so consistently, the actual situation on the ground in terms of the number of positive cases and the number of hospitalizations has been consistently below the projections in the model that we first started using from FEMA and then adopted to our own experience here in Delaware. And mostly because we've used fairly conservative assumptions on the high side in terms of the percentage of new cases that will require hospitalization, and of course in the day-to-day growth in the number of new cases. And so you see that the actual, now the projection going forward for April 22nd to the 25th is below what our model suggested back on April the 14th. Now, how's all this relevant? It certainly confirms to a certain extent that our efforts to flatten the curve have been somewhat successful. Here's just a graphic illustration of just what was on the last bar chart that shows the earlier graphs with much steeper slopes there, and with the actual experience on the ground in the, I guess, orange, brownish like line underneath of all those projections. Here are the cases and hospitalizations that we actually saw on the ground. The cumulative number of cases is the top line. You see the last little segment on each, the top line and the bottom line, are the projections based on assumptions for the model. And we are at 200, we're actually at higher than 268, but I'll come back to that. So what are we really looking at going forward? Is this case, the new cases by day? So the CDC recommendation is that a state will be in position to start moving to phase 1 under a certain set of conditions. One of those conditions is that they've peaked and they're on the downward slope in terms of the number of new cases each day. And so you can see on this bar chart that we are on a downward decline in terms of the number of new cases each day, even though obviously with each new case, the cumulative number is going to increase. but the additional number to get to the starting line has to be 14 days of declining cases, and so we'll be looking at this. We do have to factor in the fact that the test results that we get back kind of aren't even and consistent, and so we might have to correct for that in our day-to-day analysis of the new cases. In addition, the state has to have in place enough hospital capacity, which I think we're showing and demonstrating that we do have to accommodate any kind of surge that might come back in the future. And it has to have, most importantly, a new testing plan and program in place that enables more widespread testing of both people that are symptomatic and asymptomatic, and a stricter adherence to isolation for those who are identified as COVID-19 positive, as well as people that they would have come in contact with. So a rigorous contact tracking program with public health workers reaching out to reach those individuals and encourage them to get tested or to quarantine themselves. So that's a really important part of it. We're not there yet. I would say over the next few days or week, we should have more to say about the resources that we have to do that. There's a lot of discussion and debate in the media about this one, saying that states have the capacity to do it, and those and others who say, mostly the states, we don't have the capacity. The simple reality is that most states do not have that capacity right now, and everybody's in competition trying to get the testing kits necessary to do that and to stand up the contact tracking teams in order to implement the full program. So just a shout out to some of the volunteer efforts, really incredible volunteer efforts and engagement by community organizations and employers and volunteers across our state. We just had a very successful food drive or giveaway there at the mall, at Christiana Mall. National Guard, incredible work helping with that. We thank them. Department of Transportation on logistics, a really good job there. Everybody working together on these drive-through mobile pantries, distributing food to those for whom food security is a big issue, and increasingly we're seeing that across the state, even with our very successful efforts to deliver school breakfasts and lunches at schools and through the school districts across our state, which was a concern that I had early on. AstraZeneca, one of our corporate citizens here in our state, with a very important personal protection equipment donation of surgical masks. We hear this all the time from healthcare workers and first responders, the need for surgical masks. It's not just here in the state of Delaware, it's across the country, and so there's a huge competition, so huge shout out and thanks to AstraZeneca for that. And then Brian Clifton, an engineering teacher at Waters Middle School in Appoquinimink School District, creating 3D printer ear guards for healthcare workers. You can see him there pictured, and really a nice effort. A volunteer effort going across our state. So we have a lot of hard work to do. We're really focused on areas in our state where we've seen a little bit of an uptick in new cases and hospitalizations. We are seeing a bit of a flattening, although certainly not a trend yet. We hope that will be the case. Just to reiterate kind of the guideline, which is 14 days of declining cases, a declining of patients who present with flu-like symptoms before you can start thinking about, do you have all the infrastructure in place to move to phase one? And then another 14 days of declining cases. And so you add them up together, you get 28 days of declining cases before you start really ramping things up and reopening the economy. So that's going to be our approach. We're going to engage the community at every level for a discussion about that, so everybody understands the criteria under which that we're going to use to make these decisions. And obviously some business will be in a position to move back to business before others, and we'll be just like we close some businesses down before others, and we'll be working hard with each of those sectors to determine when and under what conditions folks can go back to business. So with that, as an introduction, I'm going to turn it over to Secretary Cade. Let me just say, first, thank you to Saran for his work and the work of his team in the Department of Labor. Unprecedented number of new unemployment claims like no other time in the history of the department or the history of our state for that matter. You broke the all-time monthly record in 2 days, I think, in week one, and continue to see that onslaught. The good news is we've been making a lot of those benefits available to individual Delawareans who are out of work here in Delaware by the thousands, and importantly with additional resources from the federal government. So Secretary Cade, thanks for your good work and that of your people.
Thank you. Would definitely like to highlight the work of the staff at the Department of Labor. We've been working around the clock, weekends, came in on Good Friday, a lot of them to make sure that we can process this historic number of claims, as the governor mentioned. The first slide that we have kind of highlights the volume that we've seen. That 61,842 number is what we have received in claims starting March 15th when this crisis began. So in less than a month, we have received 61,842 claims, which is almost very, very close to what we've received in the last 2 years combined in unemployment. This is a staggering number, I know, as compared to what we've processed in the past. The number below represents what we paid out in unemployment benefits to workers, qualified or eligible workers rather, and that's $30 million that we have paid, and that's not a typo, to be clear. To give you some context, the average amount that we would pay in unemployment on a weekly basis would fall typically between 1.5 to 3 million as a high.
For a week?
For a week. And so
this is a weekly number.
And this is now the weekly number that we're seeing. So definitely a very high volume of claims. It's important to note that number, that 61,842 number, is also reflective of individuals who applied for benefits but may not have been eligible for benefits. So that full number doesn't include everyone who was eligible for benefits, or includes everyone who's eligible for benefits as well as people who are not. So at the time, individuals who are independent contractors or self-employed workers who were made eligible by the CARES Act, a lot of those workers applied for benefits, but were unfortunately at the time denied because the state is in direction of the federal government needs to stand up a specific program for those workers. So that's an important point to note, as that probably represents about 20% of the claims up there. So once you factor in that number, the vast majority of workers who are qualifying or eligible for benefits have received those benefits to date. And so that's an important number to recognize as well. We're still nowhere where we need to be. We're not where we need to be just yet. Let's go to the next slide. We have, because of the sheer volume of claims we have received, thousands of folks have tried to call into our offices to ask questions about their particular claim and have noted that they may not have been able to talk to someone, or they may not have been able to get in contact with a person. So we've been directing people to file their claims and send emails if they have questions to uiclaims@delaware.gov. It may take some time to get to your question, but these are for a lot of these questions are coming in from people who may have made mistakes during their claim while filing their claim, or may have other concerns that are creating barriers to them getting their claims processed. So we just want to make sure that everyone has all the facts associated with unemployment insurance. So we've added text updates to the Department of Labor. So if you text UI fax to 555-888. Not only will you receive an immediate update with the most up-to-date FAQs that we have, but you will also receive periodic text messages that will update you on any new information, such as new programs that have been developed or that have been implemented by the federal government. To date, the 3 programs that have been established by the federal government, 2/3 of those have been implemented already by the agency. The agency was one of the first in the country to begin paying out the $600 benefit to workers. We just began the 13-week extended benefit payments at the beginning of this week. And we expect in the next 2 to 3 weeks, hopefully, to have the new system developed for workers who are independent contractors or self-employed individuals that the agency has never had to serve in the past, that there will be a program designed and available for them in the coming weeks, and we'll be releasing more information as to when that date will be for rollout. But we expect it to be an important program to roll out for people who are in need.
So Secretary Kate, thanks for that information. Just an unprecedented number of claims, and your claims processors have been really under the gun and doing a Herculean job at getting those claims processed and getting checks out to somebody. What was the percentage of checks that you say that people have already received?
So far, 65% of the individuals who have applied, that full number, have received benefits. But again, that is of the full number. We know that 20% of that total wouldn't be eligible for benefits as is. So
it's actually a higher number.
It's much higher for individuals who actually are eligible for benefits.
So one of the things that you and I both hear, and just by way of information to the public, is what, mostly from employers obviously, is what this is going to do to the unemployment and insurance fund itself. I know I've heard you answer this question a number of times in terms of when that calculation is done and all of that.
So we have a couple of different buckets. So for nonprofit organizations who are reimbursable, those workers, those employers, their unemployment taxes are essentially paid on the back end. They don't pay quarterly taxes up front into unemployment. Once an employee has been laid off from one of those organizations, the company is responsible, or the nonprofit is responsible for paying those benefits out the following month. As a result of this crisis, we have delayed that for the next 90 days to give the state opportunity to develop a long-term strategy. For businesses, their unemployment taxes are assessed every October based on the previous year's activity. And if you could understand unemployment as an insurance rather than just a benefit, the more you use it, the way the system is typically designed, the more you use it, the higher your rates would be. Just like if you got into a car accident with your auto insurance, the more you did that, the higher your rates would be. The same is true for unemployment. In this particular situation, since these employers had to lay off a lot of workers as a result of this crisis, what we have said is that we have not yet been able to make a determination as to what, if anything, what we will be able to do to address this concern. We're waiting to get more information from the federal government and the upcoming CARE Act adjustments that we expect to have some impact on state government's ability to address this concern for businesses. As of now, being in line with other state taxes, employer taxes are still due, quarterly taxes are still due for unemployment at the end of the month. But to be clear, there won't be an impact on on their tax rates as a result of this crisis. That wouldn't happen until next year. So that gives us time to develop a long-term strategy to address those businesses, the impact of this crisis on those businesses' unemployment tax rates. So
an issue we'll be looking at as we go forward to try to figure it out as we try to help businesses stay afloat and continue to employ Delaware.
Absolutely.
All right, Secretary Kate, thanks very much. Mike?
Sure. Thank you, Governor. The As the governor had mentioned earlier in his remarks, the Delaware Economic and Financial Advisory Committee met yesterday for the fourth time this year to update its revenue forecast. And since the time the governor's proposed budget was announced in January, the revenue estimates over fiscal year 2020 and fiscal year 2021 have been revised downward by $784.5 million. Obviously, that's a significant decrease from the time at which the budget was submitted, where the financial plan at that period of time was proposing a modest budget growth of just under 4%, but record investments in capital infrastructure and investments throughout the state in school infrastructure, building construction, investments in our parks, investments in our museums, investments in our libraries. So there has been a significant change from the time at which the governor has submitted his budget that has been primarily driven by much of what is occurring in the economy today, and the majority of those decreases in revenue are related to our personal income tax collections as well as our corporate income tax collections. And really, just to put it into perspective, to show that the size of the increase, we have a current operating budget that is just at $4.4 billion that is being implemented, as we speak today. But the decrease in revenues itself is going to require not only adjustments in the current year budget of being able to continue to pay for state government operations, but also in the financial plan that was introduced to the General Assembly in January. So really, what we're confronted with is a two-year problem of being able to fund our current year budget and being able to develop a budget for fiscal year 2021 in an environment where our revenue forecast is extremely uncertain. I would also add that while much of the news is not positive, there is a small silver lining in all of this, and that what you hear from surrounding states is some of their budget difficulties, but us as a state, we have practiced with the governor's leadership as well as the support of the General Assembly some fairly strong financial practices, in that the operating budget over the last couple years has averaged around 4% growth, which was around what our revenue was growing at. But more importantly, we have also set aside as a state over $125 million in the savings account to be able to be used for purposes such as what we're experiencing today, and help be able to mitigate, not entirely in and of itself, but mitigate the impact of revenue loss. And I think as we move forward over the next couple of months, and not just working with all of our cabinet officials, but also our General Assembly, being able to try to develop a financial plan that's going to be responsive to the current environment, but also one that takes into account that we have had savings in our budget over the last couple of years, and being able to use those to help mitigate any impacts to what we're experiencing as a revenue downturn. But just to illustrate, if we can go to the next slide, how difficult the budget challenge is that when you look at how our budget is broken down, almost 70% of our costs can be broken down into three categories. One is people. People represent the lion's share of our services, and these are your teachers, these are your state police troopers, these are your correction officers, these are your social service workers, these are your family service workers, and they are a fairly significant part of our budget. But the other piece is also Medicaid, which is health care for those who are less fortunate in being able to provide services, not just for their health care, but also in long-term care facilities, dental services, and whatnot, and that represents almost 20% of our budget. And then lastly is, we do have a fairly robust capital infrastructure program, and we have to pay debt service on those costs. So when you look at how challenging it is when we experience a revenue loss of almost $785 million over 2 years, and roughly 3/4 of our budget can be broken down into three areas amongst people, healthcare, as well as debt service costs. It just kind of magnifies how challenging the situation will be as we develop a budget with our partners in the General Assembly. for fiscal year 2021, which is a little bit exacerbated by the fact that the revenue forecast that was presented yesterday, one of the key themes associated with that was simply the level of uncertainty. We do have personal income tax collections and corporate income tax collections that those collections are being postponed from our normal date of April 30th through July 15th. The uncertainty around new business development and the uncertainty around just being able to know how long the pandemic will last in terms of the ability to begin to collect a tax base that we are is needed to be able to fund our budget. So really with that, we do have a significant challenge. It's a two-pronged problem. One is the current year of being able to fund our budget with a declining revenue base, and then the second challenge is being able to fund our budget for fiscal year 2021 in a very uncertain economic forecast.
So thanks, Director Jackson. If we could just leave that pie chart up there, just to kind of translate this into things that are meaningful, that to ordinary folks paying attention here, that Medicaid piece of the pie of 18%, it just represents the state half of roughly the state share, which is about $800 million out of a $4.6 or so billion budget. And those costs will no doubt increase because of the response to COVID-19. You heard Michael say that a big part of that goes to long-term care facilities. These are facilities where we're most concerned about the vulnerable populations being in there, and we've required additional measures be taken to protect those patients, and so those costs no doubt will go up. And then nearly half of the budget, so closing in on $2.4 billion is for state employees, and we'll do like every small business and every business owner in the state in terms of trying to protect those jobs and make sure they're secure so they can provide really direct services to people across our state. Beyond that, you add in debt service, as Mike said, there's not a lot of room to maneuver when you're losing that kind of revenue. Fortunately, we do have some reserve funds. We've been very careful about spending over the last 3 years, and we entered this pandemic situation in a pretty good fiscal position. So much for that.
Very different landscape today.
Yeah, so lastly, I just I'd like to say that we remain really with our heads down in our response to the COVID-19 pandemic, really focusing on flattening that curve. Our message still remains for people to stay at home, practice basic hygiene, protect your neighbors, look after your senior citizens. We're doing that in all the ways that I mentioned in terms of restriction and measures to protect seniors in long-term care facilities, and working with our hospitals to test more Delawareans and to test Delawareans in communities that have been affected disproportionately, targeting, again, those nursing homes. We're working on developing that testing program that's going to be absolutely essential in transitioning to reopening the economy in our state. We need 28 days of declining cases to get to that point, and working together, we think that we can get there. Once we do start opening in phase 1 and phase 2 and ultimately phase 3, it's going to be very different for folks in terms of the way they conduct their daily lives, with potentially mask wearing, with social distancing, with avoiding large gatherings still, because the virus will still be present until we have a vaccine or an effective treatment. So let's all stick together, and if we do, we'll get through with this. And so with that, we open it up to any questions.
Hello.
Hello, ma'am.
With the revenue projections, is the state considering cutting state employee salaries or furloughing state employees?
So as I said a minute ago, our focus will be on protecting our state employees, just as small businesses and others have done that with the effect of revenue loss in operations. But we're going to have to, take whatever measures are necessary, obviously, to close the gap. We cannot deficit spend. Obviously, we can borrow money for capital projects, and that's something we'll be thinking about doing to help, get more construction projects and putting other people back to work. But it'll probably be the biggest challenge for us because you got to pay our Medicaid expenses. They go to providers, and those providers are under the gun right now, whether you're talking about individual healthcare practitioners or whether you're talking about our hospitals. So that's the biggest part of the budget.
Is that an active conversation right now about?
No, we got our heads down. I'm sure Mike and his people are thinking about it. I have my periodic calls once or twice a week with legislative leaders. Mostly we talk about the situation on the ground in their districts. Very focused recently in the last week on the uptick in cases with poultry workers in Sussex County and our response to that. We think we have a good approach to it. So those are the kind of conversations that we have. Increasingly, those conversations, as I started with my remarks here, go to what are the conditions necessary? What is the plan for reopening parts of the economy in Delaware? We're ready to go. And my starting point is a few words of caution that we're not there yet, but we will continue to track those positive cases and that decline. I'm reasonably comfortable that we have hospital surge capacity. The hospitals have been great. AJ Shaw, who's normally here with us in the briefing, has done an excellent job working with partners there. What I'm worried most about is the more extensive testing program, and in particular the contact tracking, which is a necessary element of any kind of reentry.
And with the stimulus money coming to the state, where do you see a majority of that going towards, considering the restrictions that are on it? And will what the state spends it on be available to the public?
Yeah, so I'll let Mike take some of that, but essentially it can only be used for additional expenses that the state incurred in responding to the pandemic, right? So we are in the process now of thinking about standing up units to transition patients, elderly patients from hospitals before they go back to their nursing home, or in a case where the nursing home we don't feel is ready to take them back. So that'll be an additional expense. Similarly, we may need facilities to isolate the people that we've identified as COVID-19 positive in our outreach work in certain of these communities because they can't isolate at home, those kinds of things. Additional resources for DEMA and for protective equipment, those kinds of things. Mike, would you add to that?
Yeah, just a few clarifying points. I mean, the first is that we're working hard with our congressional delegation to see if there's any opportunity to be able to help use these funds for revenue loss mitigation, and that's an ongoing conversation, as you can kind of see with the.
And by the way, the number one priority of the National Governors Association, chaired by our friend across the line, Larry Hogan in Maryland.
So that is an ongoing discussion. The other piece is just to emphasize is that we have not taken full possession yet as a state of the state's allocation of funding. We also continue to wait on guidance from the U.S. Treasury Department on what is actually considered to be an eligible expense. The governor mentioned a number of the items around what we're hoping to be an eligible expense to be able to use for those funds for costs that are beyond their budget, and that is everything ranging from personal protection equipment, other types of items that are related to the pandemic, state employee costs that may be where they're incurring overtime for working on those types of initiatives, as well as a number of programs that have been put in place to be able to help stand up certain industries, whether it's child care facilities or whether it's the hospitality loan program, whether it's additional rent or mortgage assistance funding, of being able to use the stimulus money to be able to help pay for those types of programs that have been implemented. And
the state really did step forward on a number of those things that Mike just mentioned. Child care comes immediately to mind as a really critical and essential service that was needed, that where we had to spend more money than we otherwise would have.
correct. So it's I would imagine as we go forward and as we, as a state, continue to realize costs that are beyond our budget, we recognize the initiatives that have been put in place is also working with our municipalities and being able to, assuming the appropriate guidance from the Treasury, of being able to help where we can with regard to costs that they may be incurring as well related to the pandemic.
And not related to the economy, but in terms of race and demographics data regarding coronavirus cases, do you know when that will be released this week?
Yeah, it should be soon. My understanding is that we're starting to get that data in. If you understand what I may have said is our merging of the two databases to fill in the blanks. My expectation earlier was that we would get most of that data, with that overlay. I'm not sure that that's going to be the case now, but we will share at some point what we have.
And is there a concern, though, that since it wasn't available from the beginning, that it caused the state to respond slower to certain communities than they might have? I'm thinking about like the Hispanic community in Georgetown, for example.
Yeah, I don't think so. I don't think so. I think the challenge there was when we first saw the first positive case identified with one of the poultry processing plants, we knew where we needed to go and started at that point, getting teams together and reaching out to nonprofit organizations in the communities. And then when we started to see individuals showing up in the hospital, we needed to really we had to really ramp that up. So Delaware is small enough to understand and to see where things happening that you can respond. And I think if, as we look across kind of a heat map in terms of where the cases are, they are congregated in certain areas and than others, and those areas are ones that we've looked at, increasing testing, for instance. I mean, that's the first thing you want to do. You want to find out, what is the situation really like. Sometimes in the heat maps, they have a higher number of cases, but it's a larger population, so the rate is not as high as it might look like on one of those maps. So we are sorting through that, rearranging some of the targeted testing sites to try to get to that.
Jake Owens, Delaware Business Times. Just got a quick question for each of you, and I guess we'll start with Mike. I was just wondering, in terms of where we stand with the budget stabilization and reserve funds, would they be enough to cover the FY 2020 shortfall, and are there any limitations on some of those funds that might be able to help out?
So what you're referring to is the budget stabilization fund, which was enacted in the current year's budget, where with the leadership of the governor and the General Assembly setting aside $126.3 million as a savings account. I would say that is it's vastly different than our rainy day fund, but that is an option to be considered for fiscal year 2020. Would it be enough to cover the full shortfall for this fiscal year? No, it won't be. We're actually actively working through what our options are to be able to put us in a positive position by the next time our revenue estimating committee meets in May. I feel comfortable and confident that we would be able to get there, provided, as I mentioned earlier in my remarks, that the forecast that was provided yesterday remains uncertain, and it'll continue to shift. So we may have to continue to take stronger action as we move through this fiscal year. But I would say that the savings account itself is an option.
The rainy day fund, you probably wouldn't draw down on that because it might affect the state's overall bond rating.
I would say we would exhaust all of our resources before we look to address and use our rainy day fund, whether it's for fiscal year 2020 or fiscal year 2021.
Okay. For Secretary Cade, I'm just wondering, in terms of the unemployment insurance data that we have so far, do you have anything that breaks down furloughs versus long-term employment? I mean, some of that data captures employees that may be only furloughed for a week, correct?
Mm-hmm. So I think it's important to recognize that some of that information as to return dates and anything like that, I wouldn't have for you at this current time. A lot of employers, when they first shut down, again, we're in uncharted waters, they may have identified return dates a month away.
Sure.
Based on the 30-day initial state of emergency that went out. So it would be kind of hard to give you that number right now,
But
because some who may have started as a furlough
Right.
may have gone into a layoff shortly after, so I couldn't give you that this second.
In
but we
terms
can
of
get
the
that.
data that your department collects, whether it's a term to furlough or a layoff isn't necessarily something that's part of the paperwork then, so you wouldn't have an idea?
Well, I would be able to get back to you, but it's kind of hard to give you an exact number because some started as furloughs who ended
Sure.
up being
Okay.
full layoffs. So I would have to get back to you as to what that exact number would be.
And then in terms of the estimated wait time, so if I'm an eligible person and I put in my claim, do you have any sense
Yeah.
of how long it's actually taken to start receiving some of that money in your?
So the
fund?
vast majority of eligible recipients should typically receive their benefits within a week, unless a problem occurred while they were applying. So the typical problems that we may see that could hold a person's benefits would be failing the security assessment on the front end. We use LexisNexis, which very similar to the IRS or any other entity where they would ask specific questions that only the person who's applying should know, who owns your mortgage, what bank owns your car note. And sometimes people, get those wrong, and we end up having to hold benefits until they can respond and say that, I am actually the person who's trying to apply, and that's there for, to protect from fraud. You have other individuals who may have things as small as putting in the wrong Social Security number. We've had a couple where the employer may have turned over the wrong Social Security number, and all of these cases have to be rectified by a live person. And so the individual who falls into that pot has to now contend with trying to get through over the phones with, a few thousand other calls that are coming in at the same time. So those are the folks who end up having a concern. But the vast majority of workers receive their first benefit within the first week. It's just important to recognize that you have to go back into the system every week and report your earnings, because that is another thing that has prevented people from being able to receive their benefits as quickly as possible. You have to come into the system, say how much you earn the week prior, and then basically request your benefit. But for numerous reasons, specifically because we have so many first-time filers right now, given the crisis, it's taken a little bit of time to kind of get that message through.
Is there, to your knowledge, there's no delay in processing of new claims then?
Well, when you say delay in processing.
So if I put my
claims,
claim in, is it a week or two before it's even
If you
reviewed
do
by somebody?
everything, if you do everything that you're supposed to do, barring any, major, concern, the employer sent the wrong information over, something got keyed in incorrectly, if you submit all of the information that you're supposed to in the manner in which you're supposed to do it, then there's no reason that you shouldn't receive your first benefit within a week.
Okay. And it's my understanding that your department was either looking to contract with some third-party entities or bring on more staff in your department to
Yeah.
help process those deluge of
Right.
phone calls and emails. Has that happened?
Yes, so it's two spaces of that I want to make
Sure.
sure that I don't confuse here. So the first part of your question, which is related to volume coming into the agency. As you could imagine, unemployment can be an extremely complex topic that requires time to catch a staff person up on how it works before we deploy them to the public to assist them with this process during this crazy time. So we brought on a call center to provide service to us early last week. I've been training that call center staff up on being able to respond to claimants. We've just turned them over to address the email backlogs and that email claims slide that showed up. And so that firm is working on getting through those email responses. So a lot of claimants who had problems with filing should be starting to receive emails back regarding the emails that they sent into the office. As they begin to improve, that call center will then transition to the phones to address the people who are calling in. But we imagine that if we can get through the emails, then that will have an impact on the calls. And so that call center is up and functioning now. We've also been able to move state employees from other divisions within our agency to provide other assistance in escalating claims to get them processed quicker. So that's happening. I think the other piece is with regard to the pandemic unemployment assistance program. We also announced that we've hired a vendor to stand up a program specific for independent contractors and self-employed workers in alignment with what USDOL has required of states. And that company, we're working with them to get that program set up, hopefully in the coming weeks.
And then quickly, just for Governor Carney, we're hearing reports, obviously, that even today and yesterday, in terms of some states around the country, like Georgia, that are going to start opening up parts of their economy as early as this week. I guess I'm wondering does it concern you about the potential to put pressure on you and your administration when other states are starting to do it? Does it then kind of increase the course or pressure on you to maybe start thinking about opening things maybe before you're really ready to?
Absolutely. I mean, I think that's going to be the hardest decision we'll have to make because, as I said, we need a healthy community before we can start reopening the economy. And I don't want to open the economy a day too soon, and I don't want to delay it a day longer if I can avoid it. But, and so states that are reopening without following the CDC guidance, that's not going to happen here. If I have anything to do with it. And these protest movements that are showing up around the country saying, you know, we don't really care about what the CDC says or what the situation on the ground says, I mean, that's just not helpful. And so we're going to see that, I expect, and by the way, legitimate concerns for the need to get back to work by both workers and business folks. And I understand that. I hear the anguish in their voices. I hear the same amount of anguish in people's voices when they say, you know, don't do it too soon. You know, protect me and my family. And that's what we're going to try to do. And we're going to try to thread the needle. We're going to have engagement with the public and the business sector. It's going to be a gradual reopening, and it will be under conditions where folks are thoughtful about being careful about spreading the virus, and so spacing things out. It's going to be different. Even if you look at phase 2, is just really the first phase, and I would recommend everybody to look at opening up America again, put out by the White House Task Force, and really good guidance there in terms of what conditions have to be in place. But if you look at phase 2, it doesn't look a heck of a lot different than where we are today. And then, of course, phase 3, things start to open up there. I mean, schools aren't open in phase 2, for instance. Phase 3, things start to open up a little bit more. But our ability to get there is going to be first to have a situation on the ground where cases are declining. You know, already we're getting to the point where recoveries seem to be outstripping, you know, hospitalizations, certainly, and that's a good thing. But we're also seeing places in our state where there's a little bit of an uptick, and we've got to deal with those kind of mini surges, if you will, and do it smart. I mean, I heard somebody say this past week that I think it was Singapore, one of our businesses who has an operation in Singapore, said they opened too soon, and they had a rebound and a spike, and they had to close it down again. I'd like to avoid that if I can. I want everybody to understand the science around the decision-making and embrace that, and hopefully we can do that together as neighbors. I'm confident that we can.
This is our last question, Governor. It's from Amy Cherry at WDEL. Similar question. She asked, do you see a scenario where beaches are open by Memorial Day? If so, what does that look like?
Yeah, so let's think about the math there. 14 days from tomorrow takes you, I think, to May the 2nd. 14 days from May the 2nd takes you to May the 20th. I know that date because it's my birthday. May the 20th is just a couple more days before, I think it's that weekend, that's Memorial Day weekend. So a lot of things are going to have to fall in our favor in order to get there. I would like nothing more than to be able to do that, but it's really hard to see given the guidance that we have, where that'll be a reality. But, we'll see. I mean, we're going to be guided by the situation on the ground. We're going to follow the guidance to the extent that it makes sense. And the 14 days, if we can correct from our reporting problem, seems to make sense. Nobody's that I've heard questioned that part of it, and it goes to how much spread do you have? Can you protect? I'll tell you, the most difficult part of it is going to be having that testing program in place, with being able to deliver twice the number of tests that we're doing today, and having a core of healthcare workers that are going out there tracking contacts for each COVID-19 positive person that's tested. That's going to be a hard thing to do in a month. And that's what we would have to do to meet that. But the sooner we can get there, the happier I will be, the happier every Delawarean will be, and I know that. And we're going to do everything we can, and everybody should do everything that they can to put us in a position to be able to gradually reopen, send people back to work, go back out to places other than the grocery store, the doctor's office, in a safe way, maybe with a mask on. But we're only going to be able to get there if we continue over the next 2 weeks and month and longer to stay at home, to practice hygiene, washing hands, disinfecting surfaces, protecting your neighbors, and ultimately saving lives. We'll be guided by the number of cases and the guidance we've been given by the CDC, the White House Task Force, my colleague governors in our region that have come together on a task force, including Governor Wolf in Pennsylvania, Governor Murphy in New Jersey, on either side of us, continue our informal conversations with Governor Hogan in the lower part of our state, and think about doing things, if we can, in a coordinated way, so we don't create unintended consequences like the ones that happened back in the middle of March around St. Paddy's Day with our beaches and our bars and restaurants. So we're going to work hard to get there, and we're going to do it together. So thank you very much for coming in today.